Having an asthmatic child can be really scary for mums and dads. Sue Laurent, the Baby Channel's medical advisor, is herself a mum and has a little boy with asthma. She's here today with her little son Eddie to talk about her worries, how she copes and what you can do to put your mind at rest. Thanks for coming in. Nice to see you again.
Hello.
Nice
Hi.
to meet you, Eddie.
Hi.
You all right? Like your T-shirt? That's cool, isn't it? So now, what extra problems are brought about with having an asthmatic child for parents?
I think the thing about asthma is the unpredictability of it all. And I think that particularly, when you're a doctor, I've been running an asthma clinic for years and years, and you don't really understand what that's all about until you actually have a child with asthma. And it's the fact that a lot of the time they'll be absolutely fine, no problems at all, and then suddenly they'll get a cold. Cold's often a trigger factor, and then they'll get very wheezy. And then you'll end up having a horrible night with lots of coughing and lots of wheezing.
So what's the best way of dealing with those worries and fears?
Well, I think the first thing for anyone who's got a child who wheezes is to take their child along to see their GP. And many GPs actually have an asthma nurse who runs all the asthma follow-up in their practice very, very well. And take your child along. Are you showing us that you're wheezy? take your child along and really have to assess whether your child has got mild asthma, moderate asthma or severe asthma. Eddie, should we ask you something? Eddie, should we ask you something about your wheezing?
Eddie, what do you do then when you feel a bit wheezy?
What do you do when you feel wheezy, Eddie?
How do you make yourself feel better?
I don't know.
Should we show Isles how you use your inhaler? Should we show her how you use this?
How does this work?
How does that work? Do you want to show her?
That's a special bit to the inhaler, isn't it?
You do it this time.
Shall I do it that time? Okay, so we shake that up, don't we? This is the commonest way of treating a child's asthma. And what it is an inhaler that you can use to treat a child's asthma when they are actually unwell. So if they're wheezy or if they are if they're coughing a lot, you use this is the wrong colour, use a blue one. I'm just showing you as an example. Use a blue one, what we call a reliever. And what you do is you press it in here and the child breathes in and out, and then you can hear that little thing clicking backwards and forwards. And that shows that the inhaler is actually going into their lungs. And you give a couple of puffs of that, and then you wait and see what happens. And very often, the wheezing will settle down, the coughing will settle down, everyone will be relieved, and then your child can go back to sleep if it's the middle of the night. Thank you very much. That's a very good demonstration, Eddie.
Very good demonstration.
Okay, thank you very much.
Will be worried for the attack when the inhaler isn't sufficient.
Okay.
So what would be their kind of biggest worry, and then how would they deal
if
with
the inhaler isn't sufficient, usually you'll use up to 10 puffs through the inhaler and watch and wait. If after 10 puffs and waiting about 10 minutes or so, the child's still very wheezy, then what you want to do is take them to see a doctor. And that might be during the day, that might be your own GP, or at night it might mean going straight to the casualty department or calling out an emergency GP. If your conventional inhaler like that is not working, they'll very often need a nebulizer given with oxygen, and that'll often provide immediate relief. The other thing is that if your inhaler's working very well, but you're needing to use it more often than every 4 hours or so, then again the asthma's not well enough controlled, and you may need something else, like some steroids.
Now, are steroids, do steroids affect the growth rate of children, or is that a myth? Or
that's a very good question. If you give steroids by mouth to a child with asthma, which you will give usually once a day for 3 days or 5 days or even 7 days, that will not affect the growth rate of your child at all. It's not going to be of any relevance. It's long-term problems.
Right.
Eddie's
quite tall for a 4-year-old.
He's very tall for a 4-year-old. He's very active for a 4-year-old. I mean, he is not in any way held back by having asthma.
Right.
Because the other thing that we do with Eddie is we give him a preventer every day. Now, if a child needs to be on an inhaler because they have significant symptoms, what you do is you give them a preventer every day to stop them from becoming wheezy. And in fact, the honest truth about Eddie is that he's hardly ever wheezy. Are you, Eddie? How often are you wheezy? How often are you wheezy?
What do you mean how often I'm wheezy?
How often? Do you think you're wheezy every night or just sometimes? Just sometimes. And when you run, sometimes are you wheezy when you run? And usually that just settles down because we give them a preventer regularly.
Right, and that helps.
Exactly.
So Eddie, do you do any kind of sport? Do you play football or do you do a lot of running?
Do you do what sort of sport do you do? What do you do?
What do you mean sport?
Do you do swimming?
Swimming.
Swimming. Do you do skating?
Skating.
Trampolining?
Yes.
Did you?
Yes. Do you do lots and lots of running
things.
around?
Yes.
Do you do tennis? Yes, they do all those things.
So asthma doesn't
And he
stop
doesn't,
you
and he never
doing
wheezes
lots
at any of
sports?
those. Doesn't wheeze
No?
at any of those. No.
I do wheezing when I'm tennis.
When you play tennis, sometimes do you? When you're really running a lot.
Sometimes I get hot and I just get wheezy and hot.
Yeah, that's right.
So is asthma something that children just grow out of in the main?
That's
or?
a very good question. Lots of children, if you have asthma, it means you've got the gene for asthma. And it means you can be
Whoa.
affected by it at any time of your life. But the truth is the trigger factor so often is colds with small children. And so very often they will outgrow it in as much as they won't be getting lots of colds, so they won't be having asthma attacks triggered.
Right.
But you may find people in adult life who haven't had asthma for years who will redecorate their house or move into a new dusty place and suddenly become very, very wheezy. So
Right.
that is important to recognise that although you might grow out of it as a child, you must never, ever smoke. I think that's probably the take-home message really from today.
Right.
And I try and make sure that all the asthmatic children that I see in my clinic, one of the things I try and drum into them is never, ever, ever smoke.
Ah, well, that's really interesting. Now, I'm just thinking of viewers watching the programme, you know, that are pregnant and they're worried about, you know, if their child's going to, you know, get asthma.
Yes.
What's the best way to kind of cope with those fears and worries? I mean, is it genetic? You know, like if they have
Well,
had asthma.
I would say that if you've got, in your family, if you've got asthma, hay fever, eczema, those are the sort of things that mean that your child is slightly more likely than general population to have asthma, but by no means is going to. Most children, if they have asthma, will have it very mildly. Something like 15% of all school children, if tested, show some degree of asthma.
Wow.
Which is quite common, isn't it?
So actually, there's nothing you can do in your pregnancy to decrease the chances of your
There's nothing you
child
can do
having
to decrease the
asthma
chances of
Right.
asthma. And actually, I think the most important thing is that every child should be just treated as a normal child. And if you're worried, just go along and see your GP.
So what would be the best advice for anyone who's got a child with asthma and they're just concerned because, you know, they're having a lot of kind of asthma attacks and they're not sure whether it's really under control?
I think they need to go along and really understand what asthma is all about, understand all the sorts of treatment, the preventers, the relievers, and make sure that they're confident about the doctor that they're seeing. And if they don't feel confident with the doctor they're seeing, they can always ask for a referral to a specialist. I think that is very important.
And what age do the symptoms usually start?
Very often, if you look back, you'll see that as a baby, a child will have been quite wheezy. Every time they got a cold, will have had a wheeze, which then goes away. But we don't usually diagnose it until about 18 months. The
Right.
reason for that is that many children, when they get colds, will become wheezy. But as they get beyond 18 months, it's clear it's not asthma because they don't wheeze beyond 18 months. If they carry on wheezing beyond 18 months, then we usually call it asthma at that stage.
Right, and of course, yeah, I can see it's very hard to detect because a lot of babies have colds, especially the winter, every other week.
Exactly.
Well, ladies, thank you so much for coming in with your mum. It's been lovely to meet you, and I'm really pleased that you're being able to lead such an active, sporty life, and you've got your asthma under control. Thank you very much.
Thank you very much.
Chatting to us today.
Thank you. You can say thank you too.
Thank you.